Can you tell me your full name, where you come from, and what you're diagnosed with?
Nina Wolf, San Diego, California.
Yeah.
I'm diagnosed with Lyme disease. I should send you this article that people are wrongly diagnosed with MS when it's really Lyme. So the way my doctor explained it to me, Dr. Schickman, who's an autoimmune specialist in San Diego, what's his name, Bob?
Alexander?
Yeah, Alexander Schickman.
And he's a Lyme, he's an autoimmune specialist,
Yes.
but he takes care of Lyme disease.
Yeah, he's a rheumatologist, yeah.
Okay. And he
And a
doesn't,
brilliant doctor.
does he treat MS as well, do you know?
Yeah, he treats.
He does, okay,
Yeah.
all autoimmune disease.
Absolutely.
Okay.
Sjogren's, like he treats, he's the guy who people go, and after 20 years of being misdiagnosed, he tells them.
Okay.
And he doesn't mince words. A very serious guy. So, and I also went to Dr. Isaac Baxt, and I've also had lumbar punctures and, you know, been worked up for MS. And I said to the neurologist, Dr. Baxt, is this MS or is this Lyme disease? And he said, you don't have any clear patterns, and I'm leaning more toward Lyme. But Dr. Schickman did the Lyme, there are Lyme tests that you can take. There's this culture that Advanced Labs puts out. It's an actual culture, and you can see the spirochete grow in the dish.
Mm-hmm.
So that was positive. I'm leaving off about 5 or 6 of my doctors. I see a doctor in Orange County, Dr. Bhakta. She's the one who gave me the Lyme test. She's also an autoimmune specialist. She was on Dr. Phil talking about Lyme disease. I mean, she's a big,
Okay.
yeah. And
What's her name again?
Chitra Bhakta. She's an Indian doctor.
Right.
Brilliant.
Okay.
And so she's the one that talked me into the Lyme test. She goes, there's a new test out. It's a $600 test. I got 3 samples. It's your lucky day. I'm going to give you one. I said, okay. And so 3 months later, it came back positive.
Right.
Anyway, there's other labs that the CDC recognizes, and I was positive on the CDC test also. The CDC just said that there are 10 times more cases of Lyme than they originally thought. So they're starting
Right.
to come around, and I know even you, people are very leery about believing in Lyme, but you know, most people think you can get an antibiotic for 2 weeks and then you're cured. But if it goes untreated and misdiagnosed, like mine did for 12 years, it goes into a cyst form where you have to have 3 different antibiotics to get in there. A biofilm develops and you just, it burrows into the tissue. So I was on antibiotics for a year. Bicillin shots in my hips, 2 others, and then oral antibiotics. So I've done that whole route. So.
All right, so now let me ask you this. Someone from the medical profession told you he didn't believe that Lyme disease exists. Is that correct?
Oh yeah. A neurologist, if you go to Scripps, they laugh at you. I had to go there, Dr. Schickman sent me there for the EEG and the nerve conduction studies. And I couldn't bring up Lyme to them because they just laugh at you. So
They say it doesn't exist.
yeah, so even my son, I mean, they don't teach it in medical school. Family members, you know, have told me no. So I'm not here to defend
Sure.
Lyme. I don't care.
Yeah.
I don't care. I
Of
just want
course,
to get better.
you just want to get better, yeah.
Exactly. So.
Yeah. What are all the different things that you've tried in order to try and get your health back? You've had the CCSVI.
Yes.
On
So,
what side?
on the left side.
Left side.
So that's angioplasty, where they open up the artery to try to get the blood flow.
Yep.
I had that done twice.
And what improvement? Did you get any improvement?
0. Nothing.
Both
at all.
times?
Both times.
Right.
Nothing at all.
Okay.
I did 3 days of steroids, 1,000 milligrams a day, where I had to go and get an IV and pump all these steroids through my system, and I felt horrible after. It's really bad. That just made me, mentally, it didn't have any good effect at all. I just felt horrible after. Dr. Schickman and Dr. Horowitz both agreed that I should be on bicillin shots because I would never agree to do an IV.
Right.
I went every 3 weeks and got 2 really
Bicillin
horrible
injections.
shots. Yes, very painful.
Did they help?
No, for a full year. And
For a
then
full
at the
year.
same time I was taking 2 oral antibiotics and tons of supplements. Yeah.
So, in reality, you've been through everything they advised you for Lyme,
Right.
and none of it helped you.
Right.
Did you go to any doctors just for MS?
Yeah, I went to Dr. Corey Bloom and Dr. Baxt.
And
Well,
no
I never
help?
did any treatment. I was
Oh.
never going to, because if you take a look at the treatment,
It doesn't work.
it doesn't work.
It
And
doesn't
it's
work,
poison.
Right.
Yeah.
That's poison.
And the 5-year plan, they've done studies, and people still end up at the same place after 5 years, those who do or don't do the drugs. So I've made my decision all along that even if it was MS, I wasn't going to treat it.
So what have you done naturally?
For a while I followed Roy Swank has a diet. The last 6 months I've done Chinese medicine. Spent a lot of money, like hundreds of dollars every month. And then you had to brew these teas, 3 times a day and drink them, and they taste disgusting. And actually I've gotten worse in the last 6 months. I in the past 3 years have taken so many, it was taking 50 a day at one point with these, and I said, this can't be good for my body, it's
And
too
it's
much.
not helping?
Nothing helped.
No.
Nothing has helped.
No, because how many videos you've seen on my website that shows the vitamins they're using, and none of them get any help out of it.
No.
Herman Mack, he spent a lot of money on it, and he got the amalgam removed from his teeth, it didn't help. When you walk now,
Yeah.
do you use a walking cane or something, do you?
Yeah.
Oh, yeah, it's in the corner there. Okay.
Now I have a brace on.
Why do you
So-
have the brace on?
Because I have drop foot, if I don't, I'll trip. When this is off, this whole leg is a different color than that one. It's colder, it's pinkish
No,
red.
blood.
Purple.
It's colder because there's very little blood flowing through there, and
Yeah,
you've
and
got
I
to
pointed
change
that
that.
out to doctors, and they say, oh, that has nothing to do with anything.
Right. That's why they'll never get anywhere with this
Yeah.
stuff, because they don't listen. So exactly when did your very first symptom begin?
Actually, it was 1997 when my ears started ringing. Tinnitus. And I'm
So you had
looking around
tinnitus
going, what the heck?
In one ear. Which ear? Left ear.
It went back and forth.
Oh, did it?
Yeah. And so we were in Arizona, I remember the day that happened, and then we moved to San Diego, and I went to Dr. Halsey at ENT, and he did all these tests on me. So that was the beginning of my journey of symptoms. I mean, I went through a period where I just woke up every morning with like a really stiff neck. And then I'd go and get like medical massages, and that would work it out. There was a woman who actually got in there and did therapeutic massage. It
So
hurt.
deep tissue.
Yeah.
Okay, that's good.
She told me she could feel my tendons like twisting. Like she worked me.
Good, good.
I should have gone more because she was really good, but it hurt.
Yeah. That's a really bad reverse lordosis curve. Any questions?
No.
You see this gap here between the C2 and the C3? That's a healthy disc.
Okay.
C3 and C4, that's a healthy disc. C4, C5, that's getting a little narrower than these two, but it's still a healthy disc. But here, when you get down to C5, C6, it's getting thinner. And then C6 to C7, that's getting thinner again. So this one is the bother, that's the worry, because you've got calcification build up on these 2 points. So if you get a pain down in your lower neck, that it'll be caused by that calcification area and the compressed disc. Put the pen on the table and put your hand on top of your head.
It doesn't go, I have to go like this.
So you can't lift your hand up as
No.
high as the top of your head.
No.
That's better. Now, stretch these when you go down. This is part of your problem here with the left arm. So keep your head straight and stretch the traps when you go down. And count 1, 2, 3 and then breathe. That's it. Stretch them down, count 1, 2, 3 and then start again. Now, so that's a really good exercise for you, because I think the arm is strong enough to pull its own weight with that dumbbell, at least for the first few reps, and therefore it's going to improve through that exercise.
Okay.
So that's good. Now the next one is to do side bends. The dumbbell hard enough to hold onto it. So down to the knee, look to the floor, breathe in. Yep. And the other side. Excellent. That's really good. Okay, just stop there. That's about even.
Okay. I wouldn't have even been able to have my left hand meeting gently like this and assisting with the buttoning. I would just was going like this. So now it's like halfway back. Putting on my bra, like when I would swing it around and then try to put it together, this hand was like, had no strength. I could hardly even do it. So I finally had to just clip it and then put it over my head like a shirt.
Right, right.
So now, yesterday and today, putting my bra on was like I could do it standing up. But that was the other thing. My balance is back.
Excellent.
So there's a lot of little things that I had lost that are
Coming
back.
So just let me clarify that. So prior to coming here,
Yeah.
you couldn't bring the left arm over to near
No.
your right?
No, it didn't have any coordination.
Okay.
It was spastic.
Okay.
It was turned. I couldn't, like,
Yeah.
and now it's just like, you know, gentle, it's listening, it's
So Clint, you shake hands with me and grip hard. I want to see. See, that is better. That is better. That's taking a lot of effort. I can feel the tension in your thumb coming against my hand, and I can feel a grip from the rest of your hand now.
So I should buy those grippers?
Like the squishy ball would be better because you've got more movement. I want you to put both hands down. Yep. Now I want you to lift your right leg up as high as you can.
Okay.
That's it?
Yep. Even the right, yeah. That's as high as it goes.
Where does it hurt doing that?
It doesn't hurt, it's just I don't have any stomach strength.
Don't have stomach strength. Now I want you to lift this one up as high as you can go. That's it.
Yep.
3 inches,
Yep.
4 inches at the most.
That's
Now I
it.
want you to bend your knee and slide your heel along the bed and bring your knee to your stomach. Now I want you to extend your leg up like that. Then it starts going back down.
Yeah.
Alright, we do the same with this one. You can't even bend the knee on that.
No.
one. Alright, lift your left leg up. Bring your knee, bend your knee and bring your knee to your stomach now.
Okay. So that's good. That I couldn't do.
Yeah.
And then in bed this morning I did this. Yeah.
Wow.
Oh, this is a good exercise. For me.
You pretty much had none of that
I had none of this.
on day one, did you?
Nope. So this is big.
Yep.
You want me to balance on one foot?
Yeah.
Okay. This I couldn't even do yesterday, honestly. When we were doing the questionnaire, when was that, 2 days ago?
Yep.
Can you stand and balance on one foot? And I tried to and I couldn't.
Yeah.
So I'm balancing on one foot now.
Yep. Yeah, that's excellent.
I did get my balance back. I can't swing my left hand either.
So you've actually got to swing your left leg around a bit, don't you?
Yeah, I do.
So every time you move your left foot, you've got to think, lift the foot. When you feel the left foot coming up, then lift the knee and then take the step. And you go slow enough that you're allowing you did the visualization before you walked. So then you're doing the thought to match with the visualization, and you've got to give that thought time to get to your foot and your knee.
And I passed all the EEG, all the nerve conduction studies. All my nerves are fine, according to,
No.
yeah.
This is a nerve strength tester. It reads the strength of the nerve signals going through your main cervical nerves. And it makes a noise. You'll hear a buzzing that's equal to the strength of the nerve signal. And there will be a reading. I'll turn that on, I'll show you, it'll come up 0. Now, this is your C1 nerve on the right hand side. So you've gone right up to 400 there. 399, 398, so it's starting at 401, so that's as good as you're going to get. C1 on the left. $270. Whoop. I'm just going to press on your neck here. Push against me. So when I pushed on that C1 nerve, I felt the C1 vertebra move. And that's why it dropped out. See, when I push the vertebra in like that, it comes up again. So if I press on if I keep my thumb on the C1 vertebra, we're going to get a reading, but if I let it go, it'll probably go back to nearly nothing again. 220. Yeah, see, I'm moving the thumb. So there's definitely a problem with your C1. When I don't press it, that's why you're not getting anything down here. So let's go to the C2, and if it does...
What do you want me to put for C1?
0. Otherwise we're cheating. C2 is the same.
Ow.
Sorry. See how it makes a difference to the sound when I press on the C2? Same thing there. 168. When I let go, it goes down. Same thing with that. You can just put 0. It's like it's 100. It went up to 150 when I pushed on it. C1, C2, C3. Eight on C3.
8.
C4. Just press it and see if I can get it. But I don't even believe that you have to worry about Lyme, because if you do all this stuff that I teach on the program, you'll raise your oxygen so much and you'll free your muscles up so much that your own immune system will get rid of Lyme. Anybody can pick Lyme up and have it harm them if they're low in oxygen and their muscles are tight and they're not eating really well and they're not happy. They're not releasing the happy hormones through happy emotions and experiences in life. It all makes sense to you now, doesn't it? Tell me what you think about the way I've taught you.
That everything is important. That you can't just go and expect somebody to fix you and go see a doctor or go get a treatment. Like, the way you think, your self-talk, the way you breathe, the way you hold your body. I like the balances, you know, and then let it go. It's just like in everything, just finding balance, taking the time for yourself.
Right.
You know, the big thing about finding, you know, the female part of yourself, being a woman. I was able to get this hand over the head to get the shower cap on, you know.
Good morning, everybody.
3/4 of the way there.
All right, so this is day 4.
4.
And you slept well last night?
Slept great, yes.
But you're feeling more improvement.
Oh my gosh. I feel, yesterday was humongous. Yesterday was the day.
Right.
And
The big change
took
came
me
yesterday.
over the hump, yeah.
Right.
The left arm was swinging better. It wasn't feeling as, you know, stuck by my side.
Yep.
This is what I needed all along.
Yeah.
Wow. It's crazy.
I'm very, very happy that you feel that way this morning.
I feel so good.
Yeah.
Yeah. So all around, everything just feels amazing. So it's,
So you're pretty happy right now, right?
oh, so happy. I was telling, yesterday is another family member's birthday, so we spoke to 10 family members.
Yeah.
Told them all about you and your website.
Okay.
And all the improvements and, yeah, all around. They couldn't believe you came shoe shopping and went to the shoemaker with me. Oh my God. And did a therapy session too, like.
Yeah.
So,
It's got to be done right.
but nobody's ever heard of anybody doing
Yeah.
and caring so much about every aspect of healing.
Yeah.
And so I'm just.
See, that's the key.
Yeah.
You know, therapists, we go to college, we learn all the theory, and we're trained to do sessions. Half-hour session, 1-hour session, 2-hour sessions, and that's about it.
Yeah.
You can't do anything in that time. In
No.
reality, you can't.
Right.
You know,